Welcome everybody to another Q&A with Dr. J. Dunn from MyHappyGenes and me, GC. There's a debate out there about what your DNA can and can't tell you about your health. There's confusion because some people think DNA predicts everything, some people think it's useless. So today we're going to have Dr. J explain what your DNA can and can't tell you about your health. So can DNA predict our future health, Dr. J?
No, no, it really cannot. But it can give you a good idea of where your risks are, where your tendencies and sensitivities are, and so much more. But it can't predict. Like you may have a high risk for heart disease, but you're doing all the right things to prevent it, then it will override the genetics. It's really motivating, I think, to stay on what you're doing that can prevent the things that are in your genes. I think that's the best use of that information, but it cannot say, oh, you're going to get a heart attack. And I think a lot of people are afraid to get their genes tested because they think that it's going to tell you you're going to get a heart attack or you're going to get cancer. So they don't want to know. But to me, it's the most powerful thing you can do is look at your genetic tendencies. We all have genetic tendencies that we've inherited from our parents that can color our risks of disease in the future.
So give us some specifics. What can our DNA tell us?
That's a good question, too. What we look at with the genetics is how the enzymes work in the body, but more importantly, it can help tell you like how you process nutrients. Do you have a higher need for certain vitamins or minerals than somebody else does? I've talked about like the vitamin D receptor. I've got a genetic variant there that slows down my ability to absorb vitamin D. And so I have to watch that. I have to take the cofactors with it. You can see like how your brain handles neurotransmitters. Do you even make them, which is one of the things that I had a problem with? And do you break them down efficiently? How you respond to stress. Are you able to get the stress hormones out of your body effectively, or do they build up in your system? We can tell you how to work with that. How well do you detoxify? Are you one of those people who's going to be ultra sensitive to chemicals, toxins, pesticides, etc.? Or do you have a really robust detoxification system and you can handle toxic loads better? How inflammation is regulated. Are you prone to inflammation? If so, we can give you some suggestions on how to reduce that. How your body clears things like histamine. And histamine is like a big deal. We just recently went into some deep dive into understanding histamine and all the things it can be associated with. So, how well you break down histamine and how well you make histamine is an important piece of the puzzle as well. So, it can tell you tendencies for allergic reactions to things, what classes of foods are best for you and which ones aren't. So many things that can really guide you toward optimal health by looking at the results of this testing.
And I love that idea of optimal health oriented towards normal, which is
Yeah.
what the bell curve says. Somebody in the middle is normal and everybody else is either too much or too little of something. And that's really what we're striving to do is help people get to optimal. So what are the biggest misconceptions about genetic testing?
I think one of them is that it's one gene, one issue. And I see a lot of people doing that. Oh, I have the MTHFR gene. I need to take methylfolate. And it's really ill-conceived because it doesn't take into account all the biochemistry that happens around that. What you just did to start up detoxification pathways, brain neurotransmitter pathways, nitric oxide pathways, everything starts to occur when you start up one pathway. I see doctors saying, oh, they got the VDR, I'm just going to go ahead and fix that. Or they have this one gene, I'm going to go fix that. And it's just really ill-conceived. We've proven that over and over again in the clinical setting. It's, oh my gosh, look what just happened when we started up that one pathway. And the other thing is that our genes constantly interact with our diet, our lifestyle, our stress levels, our sleep, our environment. And so if you get somebody that you look at their genetic pattern and it's, oh my gosh, they got all these genes, but then they're like, I feel fine. I don't have any symptoms. And you would expect to see symptoms with this genetic pattern. It's because they're doing the right diet or the right lifestyle or the right stress levels or sleep. They're already doing all the things to balance it out. And so that's one of the things we pride ourselves with MyHappyGenes is we look at, okay, you got all these genes. I'm not going to recommend supplements unless you have symptoms that go along with it, unless you're expressing the fact that those are a problem with your physiology. So that's why we do the questionnaire. We have people take a questionnaire and tell us how many symptoms they have, and then the software will recommend supplementation. So for some people, they're confused because they're like, wow, I got all these genes, but the software didn't recommend supplements for me. And it's no, you're already doing all the
Mhm.
right things. Either you're taking the right supplements or you're doing all the right lifestyle factors and diet, et cetera, to balance out those genetic variants. So you don't need supplements. And that is really what the goal is to get
Right,
people
right.
lined up with the right lifestyle and diet, et cetera. So we look for in the questionnaire, you get a score. So we look for those scores to go down to zero, like zero symptoms. And we know we got there. And that's the cool thing is we can check back in a month. We give you the right diet, lifestyle, supplements, and then we check back in a month and see if those scores have gone down. So it's cool. We want to get it all dialed in, like you say, optimal health.
Is there anything that DNA can't tell us?
Yeah, it doesn't really tell us what's happening right now. You may have been exposed to a toxic substance and you may be sick, or you may have an infection that you picked up along the way, or you might have excess iron or symptoms that are acute, COVID infection, etc. There's no way for us with the genetic test to tell what is happening right now. And that's why we do lab work and we ask for symptoms and we do medical evaluation and look at life context. So think of genetics as the map, not the current weather. You still need both to see what's going on currently. What we can tell you is the tendency for your immune system is probably going to struggle because of your genetics, and now you have an infection. We can just tell you what your general tendencies are, but we can't tell you what is happening like right now.
And for that, we would do what, blood work or other
Yeah,
medical evaluations. So it's in the context of testing overall. DNA is one piece, genetics is one piece if you have a health issue.
right. And it's
Yeah.
going to show you your general tendencies, not specific things that are happening right now.
And so let's go. We've done videos on individual issues that I'm going to mention. But if somebody has symptoms like anxiety, depression, or sleep issues, is that a place where genetics is helpful?
Yeah, very much. We can tell that with certain people, they have the genes that don't break down the stress hormones efficiently. Therefore, they're more likely to suffer from anxiety and sleep issues as well, and ADD. And it's so interesting because if you're born with those genes that cause your stress hormones to be higher than most people, it keeps you in a constant state of worry and stress. But you start to compensate for it. You learn relaxation techniques, you do meditation. And when I talk to people, when I see that they have the genes for that, where they can't break down the stress hormones, I'll say, do you feel like you're stressed a lot? And they're like, no, I'm not. I'm like, what do you do to balance yourself? Oh, I have to take GABA, or I have to take theanine, or I have to meditate. If I don't, I'm a mess. Or I do mindfulness, or they've learned over the years to compensate for it. But fundamentally, their biochemistry is in that stress state. And it's really cool because we can help them get their physiology balanced and then they don't have to work so hard to stay balanced with that. Same with things like histamine. Some people have learned to balance it. I'll say, do you have allergies? They're like, no, I take Zyrtec every day. It's like, oh, like
Okay. You don't really want to do that though.
it's just so funny how people answer those questions. If you didn't take Zyrtec, would you have allergies? Oh, yeah, yeah, for sure. So it's okay. We've learned over the years, again, to compensate
Hmm.
for people that have depression because their brain doesn't make certain neurotransmitters. They've learned how to keep themselves busy or think positive thoughts or take supplements that can help or take medications, etc. So they've learned how to manage it over the years. But if we get the exact right nutrients, like I did, of course, with my depression, you don't have to work at it. I don't have to work at it anymore. This is my baseline now. And it's very relieving not to have to think about it all the time and wonder how I'm going to get through the day and what things I'm going to have to do to balance myself out.
Yeah, that's really great. So We talk about how My Happy Genes is different. Why don't you tell people how we use DNA in a different way than maybe some other companies might?
Yeah, I think there's, again, a lot of people out there talking about genetics. It's a pretty popular
It's a
topic
popular topic.
right now, and a lot of misconceptions. And we don't use the genetics to really label or limit people. We use it to identify vulnerable pathways in the body, biochemical pathways that are disturbed because of these genetic variants. And that's the key. Again, not the one gene, one supplement, one diet kind of analysis. We look at the patterns of these pathways and how they interact together to get them all working at the same time. So if you've been watching these videos, you've seen my biochemical map and how we're looking at genes. But also, not to, again, label people, but to give them compassion about why they are the way they are. And again, for me, it was very relieving to know that it wasn't me causing my own depression. And when I talk to people, they're a little embarrassed. I'll say, "Are you anxious?" They're like, "Yeah, oh yeah, I really am. I'm a stress monster." And so it's not your fault. They only show you this is where your genes are contributing to excess anxiety through not being able to break down adrenaline or other stress hormones. That is so relieving to people. And so also understanding their symptom patterns, like why are these symptoms happening to me? It's because, oh, you have this gene with this gene, and you can see how they interact, and it's logical. It really makes sense. And when I start to explain it to people, they're like, oh, I see what's happening. Like I'm making that neurotransmitter, but I can't break it down. And it's because I have this genetic variant down here. I see it. That makes so much sense to me. And they really get it. I'm shocked at how many people that we've been getting tested, they really start to understand it and they want to take control of their lives and really have a sense of empowerment from it. So I love that. I love that piece. And then they can start to personalize their lifestyle and nutrient. They understand why now.
Mm.
So it's precision and it's empowerment. And I like those two terms for it.
So, what would you say is the most important takeaway from what we've just discussed?
I would say that the DNA isn't your fate, it's information. It's going to give you guidance about how to work with your body to make it as healthy as possible and to prevent disease and prevent imbalances from happening in the future. And when you understand your body, how your body's wired, you can make smarter choices that work with your body instead of fighting it. Sometimes
Yeah.
we think we know what is good for us because we've read a book or whatever. And then you get your genes tested and it's, oh my gosh, that I shouldn't be eating that. That's not good for my genes. That is knowledge that brings clarity and relief and confidence to patients.
So, DNA gives us one piece of the picture, but it's a big piece, I would say,
Yeah.
and not to make us fearful, but to give us understanding. And like you said, compassion. I think that's such an important piece that you talk about on a regular basis.
Yeah, very much. I hear so many times doctors dismissing those kind of things as just get over it or it's all in your head or
Or we have an SSRI for you.
yeah,
But we
right.
have so many choices of SSRIs and those kinds of things.
Yeah. I'm very passionate about that piece of it, helping people really get their brains balanced and their bodies balanced. And it's such an important concept that isn't being addressed. And like you say, being medicated rather than supported.
Yeah, medicated rather than supported. I like that. All right, everybody. Thanks for joining us. I hope that you will subscribe to our channel if you enjoy these, share them if you want with other people that you think might benefit. And we'll be back next week with another Q&A with Dr. J.
Thanks, GC.
You're welcome.